with regards to surgery, the problem she saw with that was that there was things going on in the pelvis that would be difficult to remove surgically without damaging vital structures. So,
good morning, everyone. It's been a minute since I have vlogged. It's 5 a.m. and I have an hour to drink coffee before my exploratory laparoscopic surgery today. I intend to use that time most effectively. My spirits are okay. My mood is good. My parents are going to pick me up and take me, and we'll see what that CT scan in fact was. They'll confirm that thickening of my peritoneum. We'll just go from there. I'm all right. It's going to be okay. I'm so glad you guys are here. Thank you for all the extra support you guys have been sending me. Appreciate it. Thank you. My coffee partner. You wish me good luck for my surgery today? No, I can feel it. I appreciate it. Hi there.
So Noah, where that red sign is,
sure.
We'll make a left.
Fine. We'll show the elevator. So they just brought me back. I'll get dressed. We'll learn more. It's gonna be great.
Never. This here. This here. This here.
Am I right though? So they got me in my gown. Blood pressure is fine. Everything's good to go. I start at 8:30 and get out at 10:30. They'll keep an eye on me till 12:30. I'm guessing I'll check in with you guys. Thank you for the prayers and thoughts. I'm doing well. My parents are doing mostly well, I think. And yeah, thank you for being here with us.
Recognize them?
so you just got out of surgery. You're already eating?
Well, I was having some nausea. I'm having some pain in my incision here in particular.
You got a little
And so
owies. New owies? Just one?
two. So here and here. This happened to me last time, but I came out like bracing, like
Yeah. That kind of pain?
so. I don't mind them making me comfortable while we move around and stuff.
Absolutely.
And from my experience with you last time, 5 milligrams of oxy for my size is, I perceive it physically to be very low.
It is very low, but
Yeah.
it just takes the edge off.
Just a little edge while we get me home, and I'll accept that. But I feel a little nauseous, so I'm gonna take
Try eating and see what happens, huh?
and then take the oxy.
Okay.
Yeah. Did they speak to you?
How's your pain level?
Like a 4 or 5?
Okay.
Yeah. Did they speak to you?
Yeah. I talked to the surgeon. She talk to you?
If she did, I don't remember.
Okay. Well, maybe she'll come in and talk to you.
Yeah.
I don't know.
That's a good update for now.
All right.
All right, guys, we're back from the hospital. I'm here with my dad. Dr. Paul has been with me and us on this entire cancer journey. The surgery was successful in the sense of that I'm safe and we got some good information. The purpose of this laparoscopic surgery was to take a look around from an exploratory perspective to confirm what the CT scan a month ago showed, which I shared with you guys, but also to hopefully take a biopsy to get some more information about my cancer, whether or not it now has changed in a way that might make it more let's say susceptible to targeted therapies, which in the past it was not. That said, I'm going to turn this over to my dad, who was the one to actually speak with my doctor because I was post-op, coming off of anesthesia, getting some pain put together or managed. Anyway, I didn't hear what the doctor had to say, and he did. So he's going to explain what he heard, and we'll just go from there.
for those of you who have supported this journey and this incredible man, my son, thank you.
Yeah, thank you.
From the bottom of my heart. So I just had a phone call from the surgeon right after the surgery. She was finishing that one up and going into their next case, so I didn't see her face to face. She described that they did the surgery went well. There were no complications, no big surprises. They did find there was some evidence of the cancer, and I said, what does it look like? I'm not a pediatrician, retired, but it's like I've never seen, I can only imagine what the inside of the peritoneal cavity would look like typically. And she's going, well, we did see cancer. I said, well, what did it look like? She says, well, it looks like plaques. Think of like their little heaped up scar tissue, almost looks like that. And so I said, well, is it removable surgically, and where did you see it? So she said there was a plaque or 2 or 3 on the diaphragm, which is that muscle, right? That breathing muscle that we have that will be at the top part of your peritoneal cavity. And she says those would be fairly easy to remove. There was no involvement of organs, which was a good thing. Yeah. And then she was pleased that where she did see plaques on the peritoneum itself, the lining of the abdominal cavity, she mentioned it being on the good side. I think I didn't get a full understanding of exactly what she was trying to tell me. When Noah gets his follow-up visit, he'll see actual pictures of the procedure, and that he'll have a better understanding.
And I'll share those with you guys.
And then she said, with regards to surgery, the problem she saw with that was that there was things going on in the pelvis that would be difficult to remove surgically without damaging vital structures. So she said there was involvement on the bladder, and it was near the urethra, that to remove the plaques on the bladder would probably risk damaging the urethra. And then there was also involvement on the rectum, and she was worried that there would be no way of removing those without doing structural damage to those locations. So bladder, urethra, and rectum, which is peeing, pooping, and yeah, that part obviously bummer. So Noah will be able to ask her more direct questions when you're with her about next steps. She seemed to imply chemo was the next phase, and obviously Noah, you've been doing a lot of research on chemo and various ways that can be delivered perhaps more safely and perhaps as effectively or more effectively. So we've got more to share, but that's the basic update of what was found today on this laparoscopic surgery. He's got 2 incisions. They blew up the peritoneum with air so they could look around there. There's incision 1 and 2, right? Yep. Never miss a chance to show off those abs, even just hours post-op. I just want to thank all of you who've been supportive and with us on this journey, and thank you, son, for being willing to, put this journey out there for people to learn from.
Yeah.
Regardless of how this all ends up, it's a journey.
Yeah. And
you are very knowledgeable. I mean, even when I was sharing what was going on, you had a better grasp of it than I did. So I'm quite impressed.
Well, thank you. Yeah, thank you for helping the channel out and for being a great dad. He picked me up this morning, sat with me, and talked me through some of just the moments before going into surgery. I'm the type with my faith to just say a little prayer and remember that anytime you go into surgery, there's no telling how that goes, even if it's likely that everything will be great. And so there are worse last faces to maybe see, not to get overly morbid, but just to make this to finish the video here, because I'm a little emotionally tired and physically in a bit of pain. My thoughts are that I don't have all of the best information to fully understand exactly what's coming, and so my goal here is to stay as emotionally even as I can and to stay out of fear as much as is reasonable. I think in the past I've gotten pretty swept away by news, and it's caused me a fair bit of pain. So I'm going to try not to do that. I am going to do my best to make sure I know what I can control on a day-to-day basis. For whatever it's worth, I will make a separate video on this. I 100% do want to have the most effective and strongest version of the right chemo for me that can be supported and supplemented with other repurposed meds and just immune system support possible. If that means the standard of care, then we'll do whatever we need to do to support my immune system there and to mitigate potential proliferation of cancer stem cells. My biggest fear about chemo, but I understand that I'm a little more up against it right now, and I'm prepared to do whatever is best and whatever I can. So yeah, my thoughts are okay. My emotions are relatively steady. Thank you for the kind words and the comments in general, the support of the GoFundMe, and just your love and your testimony and your story, and so much love to everyone else who's going through cancer. It's an absolute trip. It really is. It's a strange version of reality to be going. Yeah, it's just strange. But I know I'm not alone. I'm not unique, and I'll do my best to be okay no matter what. I just want to express that. And I'll give you guys more updates soon. Do you have any thoughts or personal emotions that you want to share?
Yeah.
I mean, because I don't know what it's like to have your son go through this. And I don't know if you had experienced this thought that maybe the worst was over. I kind of did, maybe ignorantly. But when we got that no evidence of disease, it really truly entertained the possibility.
Maybe I dodged that bullet.
Yeah, maybe I dodged that bullet, whatever that means. So.
Yeah. Obviously, never good to get news that neither of us had thought about the pelvic stuff.
No, yeah.
That hadn't crossed our minds.
That had not crossed my mind.
And it's like, okay, so I'm dealing with prostate cancer, but it's way non-aggressive compared to, example, what you have to go through.
Yeah.
But you have to deal with this thing, well, if I aggressively surgically go after, say, cancer in the pelvic area, and I have these terrible side effects for life, quality of life things, and you don't even know if it's going to actually fully make a difference long term.
Right.
So there's no clear right or wrong with cancer management, and I know when people, and we've done a lot of alternative research to figure out some amazing things. And one could say, well, for all you've done, here you are, so obviously what you didn't do anything. Not so.
Yeah.
Had we not done everything we had done, you might not even be here.
Yeah, it's very possible.
And you are asymptomatic, which is amazing.
Still asymptomatic for now.
And so it makes decisions difficult. They're not easy decisions. And it's so easy to second guess. If you're watching this and you've got some expertise in one area of cancer care or another, and you may have strong feelings about chemo or mainstream or non-mainstream or alternative, I've had to realize it's difficult.
Yeah.
It's difficult to know what's the absolute best choice, because sometimes even in the best of circumstances, and you make all the best choices, you still have situations like we're in, where the outcome's not what we wanted. Yeah. Not exactly anyway, that's for sure.
No organ involvement.
That's good.
You know, I'm not beyond silver linings, and that's a nice silver lining. No organ involvement at this time, and
and people, you were telling me, people have come back from being riddled with cancer and become cancer free.
Yeah, I'm open to it, and I'm also very open to making peace with whatever it is that I discover I can't actually control. Very open to that too. We'll end the video here, but I'm not comfortable with this being a zero-sum game, in that if I get to arrest this cancer again, or perhaps more thoroughly, and I get more time, then I won, we won, and I get to be okay and here and physically. I don't like that. It doesn't seem fair. It doesn't seem faithful to my beliefs. So I'm going to really, really pray for courage and willingness to be as diligent and as disciplined and as hardworking as I can. But I'm giving myself all the grace to ultimately be a winner no matter what happens, because I just refuse, at least conceptually, I refuse to pout or be in tremendous despair outside of what might be a natural reaction, or anxiety, or certainly bitterness. And then that gets to be how I process the remaining years or days or whatever it all ends up meaning, and maybe many. That's not okay with me. It's not going to work for my spirit. I've been given a second chance at life with addiction and recovery. And quite frankly, if I didn't live in this day and age and we hadn't caught it when we did, my bowel was obstructing. If this had been a couple hundred years ago or less, I'm already on a bonus life. But I'm not resigning myself to death. I'm just telling you what's going through my head, because it's, there's a lot of nights you lay in bed and you wonder about this stuff. Please say a prayer for my wife. I think I'm more worried about her than I'm worried about myself right this moment. This must be so, so hard for her. And I pray I never have to know what that feels like. So say, if you're willing and open to it, say a prayer for my wife, for my dad, for my mom, friends and family, and then sneak in a couple for me too, please. And I'll be sure to say prayers for all of you as well. And more videos to come and all that stuff. We'll try to keep this sharing as thoughtful and as useful as possible. It's obviously soothing to me too, so thank you.
Thank you.
See you in the next video.